This is Chris Chaplot, Dr. Chris Chaplot, acupuncturist and herbalist and exercise physiologist. This is part 3 of my pain presentation. If you haven't watched my first 2 presentations of this 3-part series, please do. I once again would like to give thanks to the online teacher Tammy Sweet, who had originally created this series for the Heartstone Herbal School. Most of my information came from Tammy. Okay, let's start. Okay, at the level of the spinal cord, there is a system, Tammy Sweet likes to call it the internal analgesic system. This is how the human central nervous system evolved to deal with pain. In the nervous system, all ascending nerve conduction information from our peripheral senses travel up through the spinal cord and into the brain. And motor nerve impulses, or information about movement, is descending, coming down and out to the periphery. However, we also have a descending sensory system, the internal analgesic system. There are pathways that are descending to deliver and then feed back to us a dampening down of pain response, or the ability for the body to help reduce the pain and the response before it ascends. That's a productive survival response nature has developed in our process of evolution through experience and adaptation. So for instance, if the left neuron releases substance P and it binds to the receptor on the neuron to the right, you will get pain. You will surely be informed. As mentioned before, cayenne and cannabis are rubefactants or counter-irritants, but they also reduce the neurotransmitter substance P. Also, there are 3 receptors, as you can see by the slide, on the left neuron. And if those receptors get bound or blocked, the neuron cannot release substance P. Our body's own endorphins, or opiates, will come in and bind to all 3 receptors. They stop the release of substance P. Anything that makes you feel good will release endorphins. One of the self-help techniques to manage chronic pain is to do things that make you feel good. Do stuff you enjoy doing. Remember, touch releases endorphins. Endorphins are neurotransmitters of connection, as in relationships. Other things that you have available in your body are called enkephalins. They are 200 times more powerful than endorphins, but they are not released as often. The other thing that works here well is called the endogenous cannabinoid system, or endogenous cannabinoids, meaning that we all have it in our own body. Our bodies make CBD, or cannabinoids. That's why cannabis works so well. This is also where opiate medication works. However, they only bind to one of the left-sided neuron receptors, only one of the 3. Where our own opiates, the ones our body produces, and the cannabinoids that we produce will bind with all 3 receptors. Okay, here are some examples of opiate medications. As you can see, morphine, which has been around for a long time, and then fentanyl. Fentanyl is 100 times stronger than morphine, but it's more addictive. It also has more side effects, and it only binds with the mu receptor, as seen on the last slide. Only one of the 3 receptors. Codeine is a weak opiate, and when you take it, your body has to convert it into an active opiate form in order for it to work. 10% of Caucasians lack the enzyme for this conversion. So this 10% of people will get all the side effects and at the same time, no pain relief. Therefore, more is doled out, etc., and the cycle continues. So it's not certain, but they think that the reason why males can manage pain a little more than females is because men have more receptors in the brain for opiates. They're not certain of this exactly, but more studies are being done. Okay, so what else can happen at the level of the spine are things called nerve block injections. This is where people have analgesics injected directly into the epidural spaces of the spinal cord. There's always mixed results with this working. There are also nerve ablations at the level of the spinal cord. This is where they go in and kill the nerve or burn out the nerve. They target the nerve or the nerve pathway that is carrying the pain signal. However, there has been many issues where the patient wakes up after surgery and still has the pain because the pain was from a different pathway, or the same, it was because it was a dysfunctional pain pathway. Also, with all invasive treatments, there's always a risk. Okay, so now again, as I mentioned earlier, the system in which we humans have evolved and adapted for the management of pain has also evolved to manage sleep, anxiety, and nauseousness. This is an endogenous system that we have developed over eons to help manage these categories. There may be more, but this is what we know so far. They found that 30 to 60% of the time this system works to help manage pain. So, how this endogenous system works to decrease pain is it lowers the anticipation of pain, changes the perception of pain. So, when patients rate their pain before and after this system is in place, the pain rating is reduced. It will also lower heart rate. And how it works, this endogenous pain control system, we have by increasing endorphins and increasing endogenous cannabinoids. They know this because when they give the drugs to block these systems, the body's endorphins blocked by naloxone or the body's cannabinoids with Rimabant, these endogenous pain management systems don't work. So what the system is called, what works a whopping 30 to 60% of the time, well, it's called the placebo effect. Yes, this is a real physiological system. Don't discount this, folks. If saying this, that, or the other thing is going to work for pain, and you believe it, well, you're doing the right thing. You're managing pain. Because it should work if you believe in what is happening, should work 30 to 60% of the time to manage that pain. It's hard to understand, especially if you don't have chronic pain. When someone is suffering from chronic pain, whatever works, and it's not hurting them, then that's their reality, and it needs to be done. Now, this has been around forever, but scientifically, medically speaking, it's really only being understood now. And we're at the tip of the iceberg as far as really understanding the system. The study of this is only about 20 years old. This is one of the oldest systems of the body. It's the system that sets the tone of safety for the entire body, nervous system. When this system is at 100%, meaning it is fully functioning and healthy, the organism, the human, feels safe, curious, and ready to interact with other beings. This is the system that overlies the other aspects of the autonomic nervous system, the parasympathetic and the sympathetic systems, or the rest and digest system and the fight or flight system. This is a system that tells you to rest and sleep, tells you to eat. It lowers pain. It is what gives you the runner's high along with endorphins. They have found in studies that with people who have an impaired endocannabinoid system get migraines, IBS, fibromyalgia, anxiety. They've done studies on poor mice that when they've blocked this system, the mice had an increase in anxiety and depression, had a decrease in appetite, and lost weight. This is why cannabis works. We have receptors in our body for all of this. It is effective as opiates for chronic pain and neuropathic pain. It's not so good for acute pain. It also works for patients who are using opiates to lower their intake or usage by 30%, and which is already known, but good to mention again, but cannabis is really good as an anti-inflammatory. It's good for every level of pain, but again, acute pain. By the way, cannabis isn't the only chemical that makes cannabinoids. Herbs in the aster family, like the daisy and pine trees and some mushrooms, have cannabinoids. Their concentrations are just a lot lower than cannabis. Okay, back to opiates. This is the best that Western medicine can come up with when it comes to pain management. 1/3 of chronic pain patients aren't able to get the opiates that they need. 12% of the people who are prescribed opiates become abusers. Opiates are stigmatized, but are a viable way to manage pain. However, there's of course the side effects, but then, from my opinion, be more aware of the alternatives and more natural ways to manage pain. I guess that's the whole idea behind this presentation. People who need opiates need them, and we need to figure out how to reduce the amount taken and for not as long with alternative systems. Okay, now in the brain, with a class of herbs called the nervines to help people with pain. As an herbalist, the idea is to treat the nervous system first. These herbs help nourish the nervous system and help people sleep. Substance P decreases with sleep, and we know that this excitatory neurotransmitter carries pain information throughout the body. Sleep also increases levels of serotonin, and the more serotonin, the less substance P and pain. Another hormone that is increased with sleep is somatostatin, which also decreases pain. So wonderful herbs like skullcap and hops acts as a sedative and quiets the whole system down. Valerian is another one that is a sedative. Kava kava is also a nervous system sedative and helps reduce muscle tension as well. Others are lemon balm, chamomile, catnip, milky oats, etc. Okay. Adaptogens. Adaptogenic herbs help the organism adapt, or better help adapt to stressor situations. They help us respond to stress, and they help us sleep. When we are always in a sympathetic state or always in a stressed response, as I discussed earlier, the body overall becomes more aware of and sensitive to pain. If we can help people better adapt and get out of stress response, it will help them deal with pain. Both ashwagandha and eleuthero, or Siberian ginseng, is wonderful in helping the body get longer and deeper night sleeps. Okay, other pain management techniques. Overall, how to help people with pain, such as massage. Massage lowers cortisol levels, lowers pain, lowers inflammation, lowers blood pressure. What it does is it stimulates that big A beta fiber, which floods the system with touch to override the pain signals coming in from the other fibers. It increases endorphins and it increases the endocannabinoids by 183%. Acupuncture, a long lineage with helping people with pain. From a Western definition of why acupuncture works, it's through an increase of endorphins. However, there are many other mechanisms here at play, and they are currently being studied. Diet is also good, not just from the herbal perspective, but from substances in our diet, such as omega-3s, which will help reduce inflammation. But it will also help increase endocannabinoids. Exercise, out of all the interventions here, this is the number one best intervention for chronic pain, especially low back pain. So things like yoga and Tai Chi are excellent. Meditation is also another fantastic way to manage chronic pain. Anyway, this concludes my presentation. And if you have any questions, please contact me at Healthy Ways Wellness Center. Again, thank you very much. And if you haven't watched the other 2 presentations, I highly recommend you do so. Thanks again. Bye-bye.